Hi, my name is Dr. Shoshany. I'm a chiropractor and I practice in Manhattan. Today I'm going to talk about Class 4 laser. It's a new laser therapy that we've been using. Some people call it deep muscle therapy or hot laser. So being a chiropractor, I adjust a lot of people every day for 20 years. So my wrists ache a little bit, maybe a little arthritic. So the laser therapy really helps, keeps me moving. But for our practice here, I've been seeing a lot of patients with shoulder pain, and it's really changed the way we treat patients with shoulder injuries, especially with CrossFit related type injuries, supraspinatus injuries, infraspinatus, rotator cuff tears. We've seen people with labral tears, and when we do the Class 4 laser, it really penetrates nice and deep, helps improve blood flow to the area, helps reduce inflammation and pain, and really speeds up the tissue healing process. So I'm naming several structures in the shoulder because in the shoulder injuries that we see people that come in that have tears or micro tears or tears in the labrum, which is that cartilaginous tissue in both front and back. And when we use it in conjunction with physical therapy, we're seeing increases in range of motion drastically in a very short period of time, where normally it would take months to get those gains. We're seeing them in visits. So patient outcome has been tremendous, and we've been able to help people that have boxing type injuries and, like I said earlier, CrossFit related overhead injuries. Having the Class 4 laser in our practice is a great tool in treating those conditions and getting patients back to doing the things they love to do in record time, in my opinion. This laser, the depth of penetration is so much more, so we can get deeper into the tissue, almost to the discs, almost into the actual joint space, the bursa, all the deep tissues. Like I've been using it on a lot of people's deep glute muscles or their piriformis muscle or their hamstring injuries. Been using this in conjunction with ART and the Graston technique. We've seen amazing results in a very, very short period of time. So it's been pretty awesome for us here. So on day one, you'd come into the office, we'd evaluate you, we'd decide whether or not it was a soft tissue injury treatment, biomechanical, which required x-rays and spinal adjustments treatment, or a combination of all of them. Once we determine what is going on, then we determine an appropriate course of treatment. Laser therapy, basically, most of the protocols calls for 2 times a week until the pain is gone. If it's a really complicated case, sometimes we're going to need more, anywhere up to 8 to 12 treatments. But what I like about this versus the other lasers that I used in the past is I find treating the patient for less visits because there's so much energy being produced into the area. The results are a lot quicker. Because I work in integrated practice, we're always adding new tools and new techniques to our practice protocol. So always be sure to check back. And if you have any questions or comments, please email or subscribe. And we're always adding new videos for new products that we get in and review, and new services that we offer.